Hello everyone, this is Dr. Sanket Pisat and this is to announce that we are going to be having our second comprehensive online masterclass, which is an online masterclass on hysteroscopy, the essentials, fundamentals, basics and advanced operative concepts of hysteroscopy online. After the massive success of our last masterclass, which had over 600 participants from more than 26 countries, we plan to make this event on an even bigger scale. This will be divided into two separate sessions. So we are going to have the first session on Sunday, the 21st of July from 9 a.m. to 3 p.m. and the second session on the 4th of August, again a Sunday from 9 a.m. to 3 p.m. The reason for dividing this into two separate sections is that we wish to go into the absolute depths of hysteroscopy, starting from the point where a beginner would be able to learn to do hysteroscopy right from the scratch. So we are going to go ahead on the session 1 with regards instruments and equipments, when to buy, which instruments to buy, how exactly to use them, how to maintain them. Then we go over to diagnostic hysteroscopy only, and we look at what I call the three roadblocks, which are the endo roadblocks, which I have named them. We call them entry, distension and orientation. So these are the three main roadblocks. Then we move on to office hysteroscopy and fluid balance. Then there is a session on cardinal principles of operative hysteroscopy and how exactly to use the hysteroscopic scissors. Then we proceed to doing electrosurgery in hysteroscopy and principles and using of the resectoscope. And finally, to the last two topics in the first session are training in hysteroscopy and how to exactly make your own simulator and how to practice on it. And we conclude with a brief overview of fertility enhancing endoscopic surgeries, when to operate and when not to operate. This will of course have a lot of time for question and answer sessions, and you will get to ask all your doubts that you may have. Then we move on to part 2, and like I said, part 2 is going to be held on Sunday the 4th of August, again between 9 a.m. and 3 p.m. and here in part 2 we start off with a recap of decision making in fertility enhancing endoscopies, and then we deep dive into the surgical steps involved in operative hysteroscopy. So techniques, tips and tricks is the whole gamut of this part 2, in which we are going to be looking first at hysteroscopic polypectomy. Then we talk about hysteroscopic septal incision. Mind you, all of this in absolute detail, where we cover each and every point as regards operative procedures with practical tips. Hysteroscopic lateral metroplasty, myoma resection, hysteroscopic synecholysis. Then in the next session, we cover, in the next part of session 2, we cover hysteroscopic surgeries for abnormal uterine bleeding, where we will be talking about hysteroscopic management of isthmocele, the management of chronic endometritis and transcervical resection of endometrium and its place in the era of the LNG-IUD. Then we break for lunch, and then in the post-lunch session we have adhesion prevention strategies in hysteroscopy, and then the part that everyone is really looking forward to, which is complications, difficult scenarios and their management. And so far what I have shortlisted is cervical stenosis, false passage, perforation, bleeding, fluid overload and air embolism, which I believe covers the entire gamut of complications that you may face. And in the last part of session 2, we are going to be having recent advances in hysteroscopy, which is tissue retrieval systems, fluid management systems and much more. So I invite you to join us on these 2 days. Again, restatement that the first session is on 21st July and the second session is on 4th of August. Both of these are Sundays. Note that registration charges for both of these sessions are separate and are going to be on an online platform, which we are going to circulate the registration link very soon. Also, the registration link will be available on our website www.endogynetraining.com. So you can visit the website to have a look at the registration link and all the details over there. I would like to conclude by saying that this is an extremely important program, whether you are an endoscopic surgeon, an ART specialist, or even a gynecologist who does not themselves practice hysteroscopy, because Complete knowledge of hysteroscopic fundamentals is extremely important and has changed the way that all of us practice in the recent times. Also, this video will be online for about 2 months after the course. So those of you who miss it during the during the live session can always see the video later, and you can take advantage of this Fact Plus like we have done for our .com laparoscopic hysterectomy webinar. We will be creating separate WhatsApp chat groups and help groups where members can help each other. You can see that on those of you who have already done laparoscopic hysterectomy course know that the members are helping out each other and solving their day-to-day queries as regards not just laparoscopic hysterectomy but gynec endoscopy as a whole. So you do get to become part of a larger community where you can ask your doubts freely without hesitation, and you can also help others who may require your help. So watch out for the registration link on www.endogynetraining.com, and please register to take full advantage of this very carefully and meticulously planned 2-day seminar on the basics and advanced concepts in hysteroscopic surgery. I thank you very much. See you.